Ngiyambona ukuthi akekho. Ubuso sibuyisele eNewcastle.
Akushiwo lutho ke nakhulunywa ngogina kuphela.
Thank you very much, colleagues. Let's welcome the Honorable Premier of the Province of KwaZulu-Natal Premier Sihle Zikalala and Honorable MEC for help to this media briefing, covering a couple of areas that are of importance in the province of KwaZulu-Natal. We are sorry about this small venue. We discovered that there's been an alteration because of the Safer Cities program. So that integration that is taking place there is meant to protect the citizens of eThekwini. So we'll look for another arrangement next week or when we have another briefing. Without any further delay, I'm going to hand over to the Honorable Premier to take us through the statement for today.
Thank you. Thanks, Mr. Mabaso. Greetings to KwaZulu-Natal MEC for Health, Honorable Nomagugu, SImelane-Zulu, government officials who are with us here, members of the media, compatriots, ladies and gentlemen. We wish to extend a warm welcome to you as members of Fourth Estate to this media briefing. We recognize and appreciate your role in being the vanguard of our hard-earned freedom and democracy. We also acknowledge the vital role that you play in keeping our fellow citizens informed, while demanding transparency and accountability from those who have been tasked with the responsibility to lead. Let us take this opportunity to reflect on the 16 days of activism for no violence against women and children, but also to deal with femicide. As you are aware, we are in a period where we are undertaking an intensified campaign on no violence against women and children, including gender-based violence and femicide. In KwaZulu-Natal, we are rolling out a 365 days campaign. We therefore call on all citizens to take a stand and say, enough is enough, sekwanele. It is time for all of us to stand up and end this pandemic that brings so much pain, suffering, and shame on our society. We recently launched the program of action on no violence against women and children and femicide campaign in the province last week. We will therefore be scaling up interventions aimed at protecting our women, children, and the vulnerable in our society. Our campaign is grassroots based, and all MECs, mayors, councillors, and amakhosi are leading programs at local levels and integrating them in line with the district development model. We refuse that our province be associated with violent crimes, especially contact crimes and the dehumanization of women and children. We will take the war to criminals and perpetrators of violence against women and children. We have mobilized law enforcement authorities and are encouraging society to speak out and not suffer in silence. It is often said that for evil acts to succeed, it is because good men and women keep quiet. We must act in unity to prevent and ultimately defeat this scourge and create an environment where women and children are free to exercise their choices without the fear of being abused or attacked. Winning the battle against this pandemic will take nothing less than all of us working together. As the province of KwaZulu-Natal, we are waging war against gender-based violence and femicide, not just for these 16 days, but for the next 365 days and beyond. On Tuesday, the 1st of December, we will join the rest of the world in commemorating World AIDS Day under the noble theme, and I quote, ending the HIV and AIDS pandemic, resilience and impact, close quote. This is a profoundly important theme. It tells us that through our ability to face up to incredible hardship and persevere, we can conquer and prevail under very trying conditions. Given where we have come from and the devastation that HIV and AIDS used to cause in our society, the fact that today we are even talking about the possibility of ending this pandemic is nothing short of a miracle. While World AIDS Day is an opportunity for us to remember solemnly all those who have passed away due to this pandemic, it is also a chance for us to appreciate all the scientific advancements that have been made to weaken the impact of HIV and AIDS globally, which was once an unstoppable pandemic. It is also an opportunity for us to take stock of the journey that we have traveled as a country and a province, and to further accelerate efforts and programs that are aimed at wiping this scourge from the face of our society. On Tuesday, our entire provincial cabinet will visit all the 11 districts of KwaZulu-Natal to engage with communities in commemoration of the World AIDS Day. We will unpack the progress the province is making. We invite all citizens to observe this day and renew their commitments toward creating an HIV and AIDS-free generation. Building stability in the road freight sector. On Friday, the 27th of November, we held an emergency meeting with key stakeholders in the trucking sector as part of effort to bring stability to this critical sector of our economy. The engagement follows recent disturbances on our major national highways, where trucks were burnt and drivers attacked in a long-standing dispute over the employment of foreign nationals in the trucking industry. We reached important commitment, which we believe that if they are implemented successfully, will guarantee peace and stability in this all-important industry. In principle, we agreed that the truck operators must with immediate effect prioritize the employment of South African drivers. We will soon, together with national government, mount an intensive operation along N2, N3 and N11 route in KwaZulu-Natal, targeting drivers without proper permit. Every foreign national who is currently driving a South African registered truck must be appropriately licensed and hold a valid permit issued by the Department of Home Affairs. The Department of Home Affairs work permit is only issued upon offer of employment by the prospective employer in South Africa. In the meantime, the truck operators have committed to providing at least 400 new jobs, and these will prioritize South Africans. We will engage with the Department of Labor and Employment to manage the database of the prospective drivers, which will be submitted by driver associations, including the All Truck Drivers Foundation and the National Drivers Federation. The department will also verify the drivers' database, ensuring clear criminal records and validate qualifications. We now have a firm commitment from drivers that there will be no banning of trucks or blocking of any road or entry to the port. At the same time, we expect the Justice, Crime and Prevention Cluster, Crime Prevention and Security Cluster, not to abandon their core responsibilities, which include enforcement of the law, and that must be done without any hesitation whenever this is required. We agree that these are stopgap measures. The long-term solutions include effecting appropriate amendments to the law. Therefore, our proposal to national government includes speeding up the review of the scarce skills policy to clarify the contentious question of the employment of foreign nationals in the low skills sectors. For this reason, we have escalated the matter to the national government, as this is not only a KwaZulu-Natal matter, it has an implication for the entire country and the entire SADC region. Our provincial government is fully committed to the transformation and stabilization of the road freight and logistic industry, which is a critical sector of the provincial and the national economy. We will work together with all stakeholders as long as they are prepared to find a lasting solution to these current challenges. The task team that have been assigned with the responsibility of addressing challenges in the road freight sector will meet weekly to receive reports on the operations. We wish to reiterate that we will not allow lawlessness to threaten our economy, and that we have no doubt that all our key stakeholders will play their role in this regard. Well, when it comes to the issue of the COVID-19, the trend analysis, moving on to the COVID-19 trend analysis, KwaZulu-Natal has had a total of 127,506 confirmed COVID-19 cases, with 6,212 still being active. Sadly, we have lost 3,340 people, while thankful that about 117,964 have recovered. As the province of KwaZulu-Natal, we are currently ranked the third highest countrywide after Gauteng and the Western Cape in terms of the laboratory confirmed cases. But we are ranked at number 4 after Gauteng, Western Cape and the Eastern Cape in terms of COVID-19 fatalities. Nevertheless, we are extremely concerned about the increase in the number of new COVID-19 cases in the province over the past 4 weeks. We are currently in week 48 of the year 2020. The actual number of confirmed cases in the week 45 was 765. In week 64, it was 869. In week 47, we had 1,134 cases. So this shows that there is a trend that is going upward in terms of the cases per week. Over the past week, which is week 48, the figures have jumped substantially to 1,652. The number of new cases increased by 30% between week 47 and week 48. Over the past week, the highest number of cases received on each day was 348 on Friday, 27 November. As of yesterday, 28 November, we had 287 new cases and no death. eThekwini continues to record the highest number of new cases daily and has contributed approximately half of the total laboratory confirmed cases provincially. In terms of fatalities, the number of deaths reported in the province has been declining in the past 4 weeks. The actual number of deaths reported was 18 during week 45, 23 during week 46, 17 during week 47, and 16 during week 48. The case fatality rate therefore remains at 2.6%, and the mortality rate was 30 deaths per 100,000 population. Amajuba and eThekwini district have the highest mortality rate and 40 deaths per 100,000. In terms of infected healthcare workers, a total of 7,132 healthcare workers have been infected with COVID-19 in the public sector since the beginning of the pandemic. Of the total infected, 88%, which will be 88 in terms of numbers, which will be 1%, have sadly succumbed to this disease. The majority of the infected healthcare workers were nurses, who made 58% of the number of infected healthcare workers. There are no new deaths. There are no new healthcare infections or deaths that have been reported as of the 27th of November. The readiness for the province to tackle the second wave. The province is monitoring the research indicators very closely and has not reached the resurgence threshold, although in the past week the number of cases have been fluctuating, with the highest number of 353 recorded on the 27th November. These indicators are monitored daily, and if the surge indicators are triggered, the provincial plan will be implemented. Distribution of cases and death by district between the 5th of March and the 28th of November, reading only new and the total number of cases. eThekwini, new cases is 156, and the total number of cases is 60,354. In Ilembe, 16 new cases. The total number of cases is 7,280. Mkungundlovu, 13 new cases. The total number of cases is 17,014. Uthukela, 7 new cases. The total number of cases is 5,285. King Cetshwayo, 7 new cases. The total number of cases is 10,757. Ugu, 47 new cases, and the total number of cases is 5,497. Amajuba, 3 new cases, and the total number of cases is 6,981. Umkhanyakude, there is no new case, and the total number of cases since the beginning of the pandemic stands at 2,969. Hirikwala, 18 new cases. Total number of all cases is 2,661. Zululand, 7 new cases. Total number of cases is 5,100. Umzinyathi, 4 new cases. And the total number of cases is 2,637. Unallocated, it's 9. And the total number of cases is 971. That therefore brings the province to 287 new cases, with the total number of cases since the outbreak of this pandemic stands at 127,506. The total number of deaths that we have experienced is sadly 3,340. And that means that rate in terms of the case fatality is 2.6%. The district with a high magnitude of laboratory confirmed cases have contributed a high number of COVID-19 related deaths. These districts are Majuba, Ugu, eThekwini, Mkungundlovu, and Uthukela. In the recent weeks, we have received reports of the following cluster outbreaks in the province. And these are University of KwaZulu-Natal, 47, one high school in Durban, 17, Ladysmith Correctional Service, 10, Chatsworth, 13, and there have been 2 deaths there. In terms of the field hospitals, we must report that the province decommissioned the Royal Shore Field Hospital in Pietermaritzburg. However, we must point out that if there is a need, we have the capacity to activate beds that were used during the first wave. In terms of the staffing, the department has also requested to extend the contract of the staff who were recruited for COVID-19 until March 2021. At the appropriate time, we will make an announcement regarding the outcome of this process. In terms of preparation for resurgence and the plan, we have developed a plan, and it is underpinned by basic actions that should be carried out when responding to the possible resurgence. And this action plan is based on track vigilance indicators, verify data and identify outbreak source, efficient and targeted communication with the community, increase screening and testing, intensify contact tracing, enforce isolation and quarantine, assemble a multi-sectoral team, and develop a content-appropriate plan. A festive season plan has been developed with the focus on risk communication and community engagement, and the clear message here is that we must continue with wearing of masks, hand and hygiene, which include washing hands and using sanitizers, social distancing, and that include management of indoor and outdoor gatherings, safety and responsible holiday conduct in KwaZulu-Natal, shielding vulnerable family members when coming back home or visiting family or friends, and engage with taxi owners, taxi drivers, and passengers on COVID-19 prevention, engagement with owners and patrons at taverns, nightclubs, as well as adherence to COVID-19 prevention interventions during weddings, funerals, church services, restaurants, and in all other activities. We will be having loud hailing at mass gathering and outside the beach, and these are part of the programs we have put in place as the provincial government. As we conclude, we wish the matric class of 2020 all the best with their ongoing final examination. We are aware of the many upheavals that they have had to endure during this time when there were disruptions caused by COVID-19. We commend them for remaining resolute and for having come this far. Both learners and educators will go down in history as the brave warriors who soldiered on in the name of pursuing education in spite of all the challenges that have been experienced this year. In the same breath, we want to assure the public that we are doing everything possible to safeguard and preserve the quality and integrity of these examinations by eradicating the risk of exam papers being leaked. As we have stated before, we will take the most stringent action possible against any individual who make themselves guilty of acts of fraud or corruption relating to the examination. They will regret the day they ever conceived such despicable and uncivilized thought. Again, congratulations and all the best to the class of 2020 for having come this far. We wish you all the best. I thank you.
Thank you very much, Honorable Premier. We are going to go straight to questions of clarity, and those colleagues that are following us in line will indicate the question. Can I see institutional counsel Sheila Jason? Liz, can you start that one?
the talks that were had with both the truck operators as well as those that were unhappy with the employment of foreigners. Now, we have seen in the past, even about a year ago, we were having the same discussions when we've seen these truck attacks. How convinced are you of the commitment from organizations like the All Truck Drivers Forum that there will be no further burning of trucks, and also the commitment by the truck operators in terms of those employment practices while this problem is sorted out? Because there were similar discussions last year as well. And then secondly, that anti-foreign sentiment that we've seen has also manifested itself in the attacks that we've seen on shop owners or traders in the Durban CBD. Are you at this point worried about any possible outbreak or repeat of the xenophobic attacks that we've seen here in the province, or how are you trying to quell that as well? And then lastly, perhaps a question for the Health MEC around the preparations for any possible resurgence or second wave in the province. How are you dealing with the current infrastructure challenges that we are seeing? For example, at Addington Hospital, I know there was a statement on the issue of the lifts, but there are many other challenges that are faced there as well. So staff have been unhappy and they've been quite vocal about how they feel about that. So what are the plans to deal with those challenges, particularly at that hospital? Thank you.
Thank you. Please.
My first question follows on from Justin's question. What action is being taken against those people who have actually burnt trucks? There's a sense from business that the government is not doing enough to bring these people to book. And then secondly, is there any likelihood of a return to lockdown level 3?
Thank you.
No, thanks. I'm sure MEC SImelane-Zulu will deal with the issue of the causes for the numbers to increase and all other issues relating to COVID. So let me take just one on this issue. We are not the one who determine the issue of levels and progression or regression. But we are hoping that for now there is no indication that will take us back to level 3 or any. We are working hard to keep the situation and keep the infection rate low. With regard to actions, firstly, I must say there are actions that government have taken. There are people who are arrested already, and those people must account. Those who are arrested for burning trucks must account. But equally, there are employers who are wrong. There are employers who have who have been found to have employed people who are not supposed to drive in South Africa. And that's why we are clear on what needs to happen when one employs someone from outside South Africa. So we are clear on that, and we will continue to take actions to enforce the law. We cannot allow act of impunity to prevail. With regard to commitments, whether we are really convinced, we are convinced that workers want to work. We are convinced that truck drivers do want to drive. We are convinced that part of the grievances that they are raising are genuine. That in terms of the labor laws, if you employ someone from outside South Africa, that person does not enjoy the protection that is given to South Africans. And therefore, some employers did things that are wrong by employing people who have no permits to work in the country. However, no one has a right to take the law onto his hand. And we believe that, as we are saying now, the government will put an operation that will cover N11, N3, and N2. We check each and every truck. We believe that will be a first step going forward. And the next step is to work on the policy, to look on whether we cannot address this issue holistically in terms of the low skills employees and how do we characterize the scarce skills in South Africa. So I think that is our approach. With regard to attitude, anti-foreign national attitude, we would want to condemn in strongest terms the attack directed to foreign nationals. That is wrong. If people are concerned, let them allow us as government to deal with that situation. And as we committed ourselves on Friday, we are going to deal with this situation in all areas. This is the first step. It is a first step that we will be verifying each and every truck that is coming into the province. But we will go to all sectors to check whether people who are working, if they are foreign nationals, we should check and satisfy that they have permits that are legitimate, because we are also aware that there are those who hold permits, but those are fraudulent permits, and we will deal with such cases objectively. Thank you.
Good afternoon, ladies and gentlemen. Thank you for this opportunity. And Sis Sheila, you are correct. We are meeting for the first time when we have lost Unyambose, and may his soul rest in peace. I think we appreciate the support that we received from his colleagues. The majority of us worked with him. I also worked with him when we were in the African National Congress before he joined government. So we are sending our condolences to the family, and I'm glad that you have raised that. Your question firstly was indicating what are the reasons that our numbers are going up. And I think if colleagues will remember, for the past 3 months or 4 months, since September, the Premier and myself have been saying the same thing over and over again. The fact that it looked like we had reached our peak, it is purely because we had a partnership with the society and the community. And we have continuously requested that partnership continues. Unfortunately, as our numbers were going down, the majority of our people started thinking that the virus is gone. And it's an issue we've been raising on a weekly basis, that the virus is not gone. The virus is still there. The fact that on a weekly basis, on a daily basis, we see our numbers fluctuating instead of stabilizing at a particular number was a clear indication that the virus is still circulating amongst us. Therefore, we needed to take greater precautions, and we needed to be able to look after ourselves really. So the reason why really our numbers are now beginning to go up again, it's because people have stopped wearing masks. People have stopped social distancing as we should and as we have been required. People have stopped washing their hands with soap, have stopped sanitizing. And we thought we had a social agreement between ourselves and the community that says we are now living the new normal. And we indicated that this new normal is going to be a new normal for as long as we do not have a vaccine. And we didn't have a vaccine, but our people continued to live the way they did. But one of our biggest challenges as a province in particular, now I'm not speaking for other provinces, is the fact that we have these entertainment areas, whether we are talking about your taverns, we are talking about your lounges, we are talking about parties and so forth. The moment our people get there, precaution goes out the window. They will drink, we will speak next to each other, we don't wash our hands, we don't wear our masks and so forth. And we continued to request, particularly the business owners, that particular element of social distancing and ensuring that people adhere to precautions should be maintained, because the business owners are the ones who have the responsibility of ensuring that we adhere to these regulations. Now I know that when you are asked to wear a mask in a tavern or in a club, you are asked to go, how do you then drink when you are wearing your mask? Well, the new normal says that you pull your mask down, you take a sip, and then you put it back up. That's the new normal. Because the reality of it is that once we start getting excited in these areas that we visit, in our parties, in our weddings, we start getting very close to each other, and we speak next to each other, and we speak close to each other, and that is how the virus is transmitted. Now, it looks very strange when it's done. I must agree. I've seen it because I've done it myself. It does look very strange. But it looks strange. While it looks strange, it keeps the next person and myself safe. So the issue here is about safety more than anything else. You find that in townships, in particular, in rural areas, if there are people who are wearing masks, masks are only there to cover their chins. Yeah, if masks are not worn properly. We don't wear masks to cover the nose and the mouth. And that's the intention of the mask, that you must cover the nose and the mouth, not just the mouth, not just the nose or just the chin. Now, we continuously have a problem. And us as females, we are better when we cover the chins. You know, you can see that the mask is only there to cover the inchebe. Now, it really becomes a problem. So we have then had to ensure that our communication with the community must be strengthened, because that is really something. If we don't strengthen, it means our numbers are going to go up. I've been saying since September that, and every time I talk about it, I always make reference to other countries that received the COVID before us. And as of September, when we had reached our peak, those countries had begun to receive their second wave. And I've been talking about it to say, if our people don't take precautions, second wave is going to come, because there is nothing miraculous about COVID. There's nothing miraculous about the fact that other countries have gotten second wave. It's purely because people have not adhered to protocols. We have a serious challenge with our funerals. We have a serious challenge with our weddings. Because even while there are regulations that are saying in a particular size hall, you can that takes 500 people, you should be able to put at least 250 as long as you've got proper social distancing. I'm making an example. But when you go to the rural areas, to the townships and so forth, that is not happening. And that is where we have a problem. Now, as part of our plan as the Department of Health, we have made sure that the District Command Council are revitalized. As of the beginning of December, we are going in the districts in particular, the 1st of December. In the districts in particular, they are going to go back and sit as frequently as they were sitting when we were in the height of COVID. Because when you have the District Command Council being active, that is where you have all your leaders in one meeting. You have your councillors in that meeting. You have amakhosi in that meeting. You have civil society in that meeting. You have ordinary health workers in that meeting. You have educators. You have everyone represented. And a plan that is implemented by all those people is a plan that is able to assist us to deal with the spread of COVID-19. So in the districts that are in the rural area, in fact all the districts, because some districts are rural, but other districts, though they might not be rural, they will have township areas, and that is where you will have some of the challenges. You saw, as the Premier was reading, that in Chatsworth, for instance, we had a huge challenge with one family, although they were living in different households, that a number of them were infected. It's purely because they started congregating, or we have started congregating, and we've just thrown caution to the wind. So that is why our numbers are going up like they are. And we are again making a request, and we are really pleading with our people that can we please ensure that we adhere to protocols and regulations, because if we don't do that, we are going to be the next country that is hit by a serious second wave. If you look at the other countries that have been hit by a second wave, US is a typical example. It is hit very badly. Italy has been hit again by second wave. We are told Japan was hit by a second wave. Right now, Japan is speaking about being hit by a third wave of COVID-19. They think they are at a third wave of COVID-19 purely because people are not adhering to regulations. So we don't want to do that, but the only government can only do so much. For us to be able not to reach that level, we need that social compact and that social agreement. Will we see a lockdown imposed? Like the Premier said, it's not within our authority as a province to do so, but I do know that the Minister of Health is currently having discussions with the Minister of Culture, Umama Nkosazana Dlamini Zuma, to look at the areas that are being affected or that are seen as having higher numbers compared to others. So if there are going to be any restrictions, let me not say lockdown, if there are going to be any restrictions, the attitude of the national government is that you might want to focus in the locality where the highest numbers are. But we are being led in preparation to that, and as soon as the discussion has been held between the minister and the national council, command council will then be able to know what is happening. However, before we get that, we are really calling on our people to be able to adhere to regulations. Let me then respond to the question of Dasin. Dasin, let me deal with the first point that you raised when you had an interview during the week in Eddington, and you called Eddington one of the COVID-19 centers. Eddington is not a COVID-19 center. Eddington right now has 8 beds, has 8 isolation beds. We have different facilities that we have termed as centers. One of them is Claywood, and we created beds there primarily for that, in eThekwini in particular. We went to Wentworth, we created a number of beds there. We went to, when you go to Ilembe, we went to Estenga. There is a center, although the hospital itself is not a center, but we've put a field hospital next to that hospital because we want to create that as a center. We did the same thing with Ngwelezane King Tetwayo. So it's also important that we understand exactly what we say, and when we listen, when we speak, and please quote us correctly, because Eddington is not a COVID-19 center. However, each and every hospital in the province of KwaZulu-Natal will have a plan for COVID-19. The plan is that when you get into a facility, you must be screened. There's no way around that. Whether you are there to pick up your medication, if you are someone on chronic medication, or you are just there to check your BP, or you have an appointment with this doctor or that clinic, we need to screen you, because in hospitals, those are high-risk areas. And if we are not careful with hospitals and we don't screen thoroughly right at the beginning, we run a risk of ensuring that COVID is spread throughout in a manner that we are never going to be able to manage it. So all hospitals and all clinics should and are expected to have screening areas, and should you be found to have 1 or 2 symptoms, you are then sent to a flu clinic that is separate or outside from the rest of the hospital. It might be in the same building, it's just that the entrance is different so that you don't mix with the other patients, but the intention is that you are not part of that. And once you get into a flu clinic as a patient and you are found to be a patient that is under investigation, then all hospitals must have beds that are separated, where these patients that are under investigation are going to be put in. Those are quarantine beds in a simple language. So every hospital will have a quarantine bed, and once you've been found to be positive, then you are then moved to an isolation bed within the hospital. So all our hospitals will have quarantine beds, all our hospitals will have isolation beds. The only difference is that the amount of beds in that hospital will not be the same amount of beds as the beds that we have in hospitals where we consider them to be centers for COVID-19. So yes, Eddington does have isolation beds, but they don't have more than 8 isolation beds. Once they begin to have more than that, they take their patients to Claywood, like any other facility, and that's what it should be happening. That's what should be happening in all the facilities that we have in eThekwini. What are the plans in relation to Eddington? And like you correctly indicated, the lifts are really our biggest challenge. Unfortunately, right now, we are stuck between two contractors who are fighting in court, and as a process of that, who is affected is our own health workers and is our own patients. That is why we have decided that every service, first of all, that is from the 5th floor going up, we are relocating it to any of our facilities, because we've got close to 20 hospitals in eThekwini alone. So we are moving all the facilities to areas depending on the space that they have. Now, those that are already there are being told where to go. The head of department and the management is currently negotiating with the unions so that, you know, it doesn't affect the workers adversely. So all the facilities or so all the services that are being provided from the 5th floor going up are being relocated to different facilities. Some are going to Wentworth Hospital, some are going to King Dinizulu, some are going to King Edward, depending on the skill of the hospital in particular. So that is what we are doing. Secondly, all the emergency services are being moved from Eddington. No emergency services are going to be provided at Eddington. EMS has been informed that should there be anyone who comes in an ambulance, they don't go to Eddington. They will be taken to any of the hospitals or any of the facilities that we have within eThekwini. So I think that assists us. We've got a resurgence plan, as the Premier correctly indicated, and within the resurgence plan, as the province of KwaZulu-Natal, we also have a plan that we are calling a festive season plan. Remember, the province of KwaZulu-Natal is very popular when it comes to entertainment. So we also need to be focused. Each and every city and each and every town has a specific festive season plan, COVID, that is related to the areas, or that is related to them and is related to the kind of activities that they have. And as part of our plan for the festive season, we are going to be meeting with all of those who hold big events during the festive season, because they need to be able to convince us that they have a proper plan of social distancing. And that meeting will be held between ourselves and economic development, so that it becomes a government, so the economic development and also MEC Pegintuli, so that it becomes our own government plan. So that is what we are working on. Our plan is quite broad. It's just that we have not delivered it here, but we do have a plan, and it's going to be multi-pronged. Thank you very much, Labas.
Thank you very much, Honorable Minister. Let's take the last round.
Question as a response, I just want to correct something. I didn't say there's a current center. I said that Addington Hospital was one of those hospitals that at the time of the outbreak, when coronavirus first came to KZN, was dealing with these cases. You're welcome to see the recording.
All right. Is that it? Okay. No, Karinda, thank you very much. Look, the issue of the events and programs that we have in the province, it's not a decision that just can be taken by the Department of Health, because they are also an economic, an economic spring for the province. They are also bringing in money, they are bringing in employment and so forth. However, this is the reason why we took a decision that we need to meet with all the planners this week, so that before the event is hosted, they are able to give us a proper plan to say this is how we are going to ensure that social distancing is going to be maintained. I've spoken to some of these events coordinators individually. You know, some of them have proper plans. Some of them are able to tell you that we will put speed fencing around every three people and so forth and so forth. Some of them have proper plans, but it's not all of them who do. So that is why we need to have this particular meeting, so that once we've had the meeting with the planners, we are then able to go to the meeting that is chaired by the Premier, which is a command council in the province, and we are able to report that our events are going to be a position of a super spreader, because that's what these become. And if they become that, then at that level, the Premier with all the executive councils and people who sit in the district command council must then be able to make a decision to say, how do we deal with them and how do we move forward. But for now, we need to meet with these people and give them a proper opportunity to actually explain to us how do they plan to implement this particular event. You are correct. That festival we are speaking about is one of the reasons that showed us that if we don't act and act quickly and decisively, it means we are going to continue to have challenges moving forward. Thanks.
Masibonge ubukhona benu nonke nomsebenzi eniqhubeka niwenzela isizwe ukwazi ukunikezela ulwazi olufanele emphakathini eyintweni esibhekene nazo. Kulesi sikhathi esikuso siKwaZulu-Natal siyingxenye ye-South Africa eku-observeni izinsuku ezingu-16 ezibhekiswe ekutheni sikhuze sinqande udlame olubhekiswe kubantu besifazane nabantwana. Kodwa KwaZulu-Natal asikwenzi nje lokho ku-16 days, kodwa sifuna ukuthi sikwenze unyaka wonke 365 days. Kube i-campaign engagcini iyi-campaign, kodwa wonke umuntu ayiphile. Siyafuna ukuthi esizweni sakithi sisho sonke sithi sekwanele, angeke saphila nobuhlungu bokuhlukunyezwa kwabantu besifazane nabantwana. Sonke masivikele abantwana, sivikele abantu besifazane. Lo mkhankaso sifisa ukugxilisa phansi kuma ward through ukubambisana no MEC namameya namakhansela namakhosi nezinduna, ukuthi apha phansi sikwazi uqinisa ukuthi wonke umuntu uyingxenye yokuvikeleka kwabantu bakithi, isikakhulukazi abantu besifazane nabantwana. NgoLwesibili lo lesiya kulo sizojoyina umhlaba wonke ekugubheni kumbe eku-observeni usuku lwe-World AIDS Day ngaphansi kwesiqubulo esithi masivimbe i-HIV and AIDS, ngokuthi siqinisekise ukuthi kune-impact esiyenzayo la sikhona. Siyafisa ukusho ukuthi lesi siqubulo sisho ukuthi umuntu nomuntu akenze konke okusemandleni ukuthi sigweme ukusabalala kwe-HIV and AIDS. Uma ubheka isikhathi esikuso uyabona ukuthi le ligciwane laba kakhulu ipandemic labulala abantu abaningi. Kodwa siyabonga ukuthi namuhla ngama-interventions ahlukahlukene uhulumeni wethu oze nawo, abantu bakithi sebeyakwazi ukuthi bavikeleke, bakwazi ukuvikela abantwana, bakwazi futhi ukuphila nalo. NgoLwesibili-ke lo mhla ka-1 iKwaZulu-Natal yonke izohlanganyela ndawonye o-MEC bazobe bekuma-district wonke lawa 11 ukuthi si-observe lolu suku lwe-World AIDS Day, ngokuthi sifundisane ukuthi sivelaphi, siqinisekise futhi ukuthi sonke siyayibophezela ekwakheni isizwe la esiyothi lolu bhubhane selingumlando. Siyafisa ukubika ukuthi ngoLwesihlanu lo lesivela kulo sibe nomhlangano ophuthumayo nabaphathi be-truck industry nabamele o-driver abashayeli, ukubheka le nkinga esibhekene nayo yokushiswa kwama-truck nokuvinjwa kwama-truck ukuthi ahambe ngenxa yesikhala esithi abaqashi baqashe abantu abasuka emazweni angaphandle kwe-South Africa. Siyabonga ukuthi sifinyelele esivumelwaneni sokuthi bonke abantu abanama-truck bazoqinisekisa ukuthi from now onward baqasha abantu base-South Africa. Okwesibili, sivumelene ukuthi sizoba ne-operation ezobihlola bonke abashayeli bama-truck abangenayo nabaphumayo KwaZulu-Natal ku-N2, N3 no-N11 ngokunjalo nala eThekwini eBayhand. Uqinisekisa ukuthi abantu abadrayivayo badrayiva ngoba benama-permit okuba la eSouth Africa. So umuntu okudinga drive i-truck either umuntu one-license okungowa la eSouth Africa or umuntu one-permit esemthethweni, hayi lama-permit angekho emthethweni. I-permit esemthethweni itholakala ka-Home Affairs, kodwa uthi uyi-aplayela ubusunento egunyazayo from umuntu ozokuqasha. Sibuye savumelana futhi ukuthi abantu abeyinkampani zama-truck bazibophezela ukuthi bazonikezela amathuba emisebenzi angu-400 okwamanje, kodwa bazolokhe bebheka ukuya phambili. Lamathuba azotholakala ngokuthi laba abashayelayo babhalise amagama abo kwi-department yakwa-Labour, okuyiyona futhi ezobuye ihlunge ibheke ngempela ukuthi labo bantu ababhalisa amagama banazi incwadi zokushayela, banazi izinto eyivumela ukuthi bashayele, abanawo ama-criminal records, umese kuqinisekiswa ukuthi bayaqashwa. Ngokufanayo sithi amaphoyisa nengalo yomthetho yonke makusetshenzwe ngokubambisana ukunqanda isimo la siphenduka khona izwe elingenamthetho. Aqine isandla somthetho, sivikele bonke abantu. Uma kunabantu esisola ukuthi base-South Africa ngokungekho emthethweni, masidedele masibike kwabomgalo yomthetho, siqinisekise ukuthi amaphoyisa ayakwazi ukuthi adile nabo ngokushesha. Lokhu-ke kuyisingenelelo, it's a stop-gap measure, but into ekudinga siyenze siyizwe ukubheka umthetho othi ngakube abantu abavela ngaphandle baqashwa kwimiphi imikhakha, yini esingakwazi ukuthi lesiyibeke eceleni as a scarce skill that requires ukuthi siqashe abantu abasuka ngaphandle. Yilokhu-ke sesikudlulisele kuzwelonke ukuthi sixoxe maqede kube nomthetho ophelele kulesi simo. Ngokwe-COVID-19 siyafuna ukusho ukuthi kusukela iqalile kuze kuzoba manje siyaqhubeka sibona ama-cases eya ngokunyuka. Singasho nje ukuthi